Thank you very much. Thank you very much, and thank you to the organizer also for inviting me to talk on this important topic, which is actually evolving for the last couple of months. So we were not much discussing about the obesity because of the fact we did not have much drugs to address the obesity. Now we have few, and we also find that there is a progressive rise in the prevalence of the obesity. Now the Indian actually have progressive rise in obesity, so much so that almost 1/3 of our population actually have the obesity. So what I want to tell you first, that in our country obesity is glamorized. Glamorized means that we feel that healthy means obesity. When I was a child, my mother used to tell that they see that the other boy in the next house is very healthy. So actually that boy was overweight or obese. So that's a important issue, that we actually say healthy as in obese or overweight person. And that narrative must change, because you know that the obesity is associated with lot of complication, especially when we talk about the complication, the cardiovascular complication. We need to understand that 1/3 of the world population die because of cardiovascular disease. Not only world, but also in our country. So obesity actually increases the 50% chance of dying from cardiovascular disease. And we actually glamorize obesity by saying that this person is healthy. So that narrative must change. So the first question is that whether obesity is a disease or not. As I've already said, a lot of comorbidities are associated with obesity, and if you look into the multiple organization, WHO, AMA, Endocrine Society, they have said that obesity should be recognized as a disease. So this must pass on to the general population, general people, that we should consider it as an obesity. I find that the people with a blood sugar level of 133 fasting come to me, doctor, I have diabetes and please treat. People who have cholesterol of say LDL 140 may not need any treatment, but come, doctor, I have high cholesterol. But nobody come to me, doctor, I have 5 kg overweight or I have 7 kg overweight. No, I have not seen in my lifetime that anybody came with 5 or 7 kg overweight. But yes, they come if they 25, 30, 40 kg overweight. Then that's a separate issue. But first of all, what is the definition of obesity? We all actually measure obesity in the form of, say, BMI. But I know there are a lot of fallacy of BMI, and I must tell you that the commonest complication or the most important complication of obesity is the cardiovascular disease, which is not much linked with BMI rather than linked with the waist circumference. In our clinical practice, in our chamber, we measure height, weight, BMI, but we never measure waist circumference. So it is the time or high time that we start measuring the waist circumference to define the people with central obesity. Now there are a lot of causes of the obesity. I will not go in detail because you had the topic discussed before. We have multiple endocrine causes like hypothyroidism, the Cushing syndrome, the pseudo-hypoparathyroidism. We have some monogenic obesity, and there are a lot of syndromic obesity as well, but these actually constitute only a small fraction of total obese population. And what the commonest cause of obesity, as you all know, is basically because of excess calorie intake. So if you take good amount of calorie over the energy expenditure, there is a possibility of weight gain. This is one of the heaviest patient in my chamber. Now if we look into the obesity and the disease, the most important concern in front of us is the insulin resistance. Why the obesity develops the cardiovascular disease? The important reason is that the many people with obesity actually have insulin resistance. So that is basically an important issue, because if we look into the obese people, 70-80% of the obese people actually have insulin resistance. But at the same time, I must tell you, the another 10, 20, 30% patient actually do not have insulin resistance. So that we need to understand. So therefore, if we look into these two important persons, you can see they both of them actually have the same BMI, almost same BMI, but one is having waist circumference 121, and there is 81, and you can see the profile is quite healthy here, and the profile of this person is actually quite unhealthy. So that actually is the difference between the healthy obesity and unhealthy obesity. So if we look into the aspect of the obesity, the 20% people, those who are metabolically healthy, they have actually low visceral volume, and they have low liver fat content, and they do not have much inflammatory markers. And also, on the other hand, the metabolically unhealthy obese people have got more visceral volume, they have high liver fat content, and they have insulin resistance, they have a higher inflammatory markers, and they are prone to develop, the so-called cardiovascular disease and cardiovascular event. So, if we look into the prevalence of the cardiovascular event and also the all-cause mortality and diabetes mellitus, you will see that the people with metabolically unhealthy obesity actually much higher chance compared to those who are metabolically healthy. So if we look into the patient in your chamber, you will find not only the waist circumference, but acanthosis nigricans and skin tags are two important markers which will tell you that these patients actually have insulin resistance, even though you are not measuring in the lab. And because of this insulin resistance, you will find that the people with overweight or obesity, they develop ectopic fat deposition. And I believe that the four important organs which are very, very important when you are considering the ectopic fat deposition. One is pancreas, second is heart, third is liver, and fourth is the kidney. So these are the four organs which actually mostly suffer when there is an ectopic fat deposition and leads to a lot of important diseases. Now, if we look into the adipose tissue, how they respond to the excess amount of calorie intake, the people with the metabolically healthy obesity, there you will find that adipose tissue undergo hyperplastic change way. It means their number is increasing. On the other hand, people with unhealthy obesity, they actually have adiposity hypertrophy or increase in the size. So one is increase in the number, another is increase in the size. If somebody have increase in number, then there is no question of impairment of the blood supply, and therefore they can accommodate more fat in the hyperplastic cells, and they usually produce some positive signals, adiponectin, leptin, and FGF21, and they actually lead to metabolically healthy obesity. On the other hand, those who undergo adipocyte hypertrophy, then there will be impairment of the blood supply, and there will be hypoxia at the level of the adipose tissue, which leads to the development of inflammatory cytokines, and these inflammatory cytokines are actually responsible for the development of cardiovascular disease or other disease. So this is the patient with healthy obesity. You can see that the adipocyte actually producing these three important adiponectin, leptin, the fibroblast growth factor 21 leads to the increase or improvement in the insulin sensitivity. On the other hand, atherogenic signal from the adipose tissue occurs if some adipose tissue, if undergo hypertrophic changes, they produce tumor necrosis alpha, the interleukin 6 resistance, and free fatty acid, and all these actually impact the important organs, leading to different comorbidities associated with obesity.